All right, so today I want to talk about the components of an aging face and hallmarks of what age and time does to your face and how that compares to a young face and the things that we see as plastic surgeons and what we start to counsel patients on that they're observing and things that they can do to correct it. So to start off, a young face is usually described in plastic surgery and in aesthetic textbooks as an upside down egg, where a lot of the volume is towards the top, and as you look lower, there's less volume and it becomes narrower. And then as you age, that picture actually becomes inverted and the egg is turned upside down. And what you have is less volume at the top, and as you look lower, it becomes wider, there's more volume down there, there's less definition, and that is what's happening in an aging face. Now, why is that happening? As you age, and this is what I tell patients, is gravity always wins. Gravity is undefeated. You can't fight it, you can't win. So what starts to happen is before things even start descending from a microscopic and a histological level, changes are going on in your skin. Your skin is producing less collagen. It's producing less collagen than you're losing. So the net concentration of collagen in your skin is decreasing as you age. The skin cell turnover rate is lower. The keratinocytes in your epidermis regenerate more slowly. You have a loss of mucin, which is a molecule that holds water, and microscopic ridges and contours in your skin start to flatten out. So what happens from a skin quality aspect as you age is it becomes lower in quality. It's less regenerative. It's actually younger. It can't keep up with the changes that are happening to it. And this is what happens when you start to see fine lines and fine wrinkles. Your skin starts to look dull. You don't have that vibrant glow that you used to have. That is what's happening. Now, from a larger scale, you have ligaments and components of fat and volume in your face that are held in place. They're suspended and they're fighting gravity constantly. And like I said, as time goes on, those compartments start to descend. And that's usually what patients complain about mostly when they come see me and talking about a facelift, is that things just aren't where they used to be. Things are droopy, things are sagging. And I completely appreciate that. And what's happening is ligaments that are holding your fat compartments and that youthful volume that you had in your face, those ligaments and fascia that hold that in place are losing their vitality, they're losing their strength as they can't regenerate as fast, like I touched on earlier. And so those start to sag like anything else in our body. And so then you have packets of volume that are out of place. And those start to cast shadows, they start to cause creases and deep lines in your face that you see and you perceive. That's what's causing that. That's that volume pushing up against these ligaments that aren't losing their vitality, and everything starts to push up against that. And so you get peaks and valleys where there used to be valleys and peaks. Now, what is also happening, and this to me is a very powerful yet almost imperceptible quality in an aging face, is you're losing volume. And what started to happen is as you age, there's fat in your face. Fat is actually your friend. It's a good thing to have in your face to some extent and to some degree. And what starts to happen over time is, like I said, that youthful volume in your face, not only is it sagging, but it's shrinking. And that to me is a very, very telltale sign of an aging face's lack of volume. And where that usually starts to happen is in the temporal area, and luckily for women, they don't usually appreciate that because they have long hair that covers it. But you can see it in the cheeks, in the mid-face, in the malar eminence. Not only is this malar eminence, this fat component here, not only is it sagging and flattening, but it's also shrinking. So that leads me to another point I'd like to touch on is, I see patients for, facial consults and facelift consults and filler and Botox and things. And a lot of patients focus on filler as, an adequate solution for a severely aged face. What I like to tell patients is, I will be honest with you that fillers fill. They don't really lift. They just restore volume. And like I said, they restore volume, and that's a powerful modality to making your face appear more youthful and restoring some of that vigor. But it can't put that volume that has descended back to where it needs to be. And so fillers are more of a disguise. They can cover poor contours and fill in where you have a deficient volume and where things need to be. But if you have a severely aged face, then things start to look out of place. If you have a saggy, malar fat pad, and suddenly you have chiseled cheekbones from filler, things are going to look very strange. And I see patients a lot who, are excellent candidates for a facelift, but they're very apprehensive about surgery because surgery is a large ordeal compared to getting a syringe or two of filler and then leaving the office. But they're expensive. A syringe of filler, one or two, could cost you $1,000, $2,000. And if you save that money because you have to repeat fillers every year, every few months, you could have paid for a surgery that would be a permanent solution. So that's what I really try to counsel patients on, especially if they fit into that older age range. But filler, to restore some vibrancy to your face for younger patients, like the 20 and 30 year age group, I think is a very adequate solution. But like I said, there's a lot of components going on to an aged face, which leads to a lot of components on how to maintain that vitality and that youthful look to your face. And there's a lot of things we can't do to fight gravity. You can't stop it, but basic skincare with hydration, clinical strength moisturizers, clinical strength cleansers, staying out of the sun, wearing sunscreen. Sun damage is the number one factor that will age your skin. It's the number one factor that will make you look older. You need to stay out of the sun and you need to wear sunscreen. Other than that, as you age and you start to see fine lines, Botox and filler are great modalities for restoring volume and for preventing and smoothing out some fine lines and wrinkles. But yeah, so that's just a little histological rundown and macroscopic rundown on what is going on when you start to perceive that your face is aging.